what if I'm too thin for DIEP breast reconstruction? Quite often we do encounter patients who have very little excess tissue on their tummy. And while we can still offer a DIEP reconstruction if it is only on one side, as it can be modified, the technique can be modified to be able to take more tissue from the tummy, so long as I mentioned, you're reconstructing only the one side and you accept the possibility that the breast on the other side may need to be reduced and uplifted to match the size of the reconstructed breast. However, we do encounter and come across patients who have very little tissue on their tummy, and the choice for them would either be to look at the option of taking tissue from their buttock area or sometimes tissue from the inside of the thigh. Again, one can argue, or it's quite likely that if you have very little tissue on your tummy, it's quite likely that you might not have excess on your buttock or on your thigh. And if that is the situation, if that is the case, then you probably may have to look at the option of taking muscle and tissue from the back and possibly combining that with an implant, which will give you a reasonable reconstruction, but does carry the slight disadvantage of having an implant and the issues that I mentioned before of maintenance of these implants.